Medicare Advantage plans are growing in popularity, but a lot of folks don't understand exactly how they work or if they're really a good value. So that's what we're going to talk about today. Stay tuned. Medicare Advantage plans are growing in popularity. And if you are about to be turning 65 or you're new to Medicare, you've probably heard of these plans. Maybe you know someone who has one, and you may be trying to figure out if this is the right type of plan for you. My name is Stephanie Apt, and I am an independent Medicare broker. I help seniors all across the country to navigate the world of Medicare. We work with both Medicare supplement plans and Medicare Advantage plans, so we are able to hear firsthand from our clients what they like and what they dislike about all of these different types of plans. So today I'm going to dive into some of the biggest pros and cons to consider when it comes to deciding whether or not to enroll in a Medicare Advantage plan. And at the end of the video, I'm also going to debunk a few common Medicare Advantage myths. So stick around for that. And I want to take just a second to ask you, if you find value in this video, please take a moment and hit the subscribe button. You can also like the video and definitely leave your comments below. We always like reading those too. Now, Medicare Advantage plans are more heavily advertised now than they have been in the past, especially in the fall during the annual enrollment period. But what exactly is a Medicare Advantage plan? Medicare Advantage plans are also known as Part C of Medicare. So these are plans that are offered by private insurance companies to Medicare beneficiaries. And these plans typically include hospital and medical coverage. They usually include your Medicare Part D drug coverage as well. And some Medicare Advantage plans also include additional benefits, things like dental and vision, that are not covered by original Medicare. Basically, Medicare Advantage plans are an alternative way to receive your Medicare benefits. And I say alternative because if you enroll in a Medicare Advantage plan, you no longer have original Medicare A and B as your insurance any longer. So Medicare Advantage plans are also referred to as Medicare replacement plans because these Medicare health plans replace your original Medicare benefits. So let's go ahead and jump right into the pros and the cons of Medicare Advantage plans that you'll want to consider. Pro number one, Medicare Advantage plans tend to be very low cost. In many areas, you can get a Medicare Advantage plan that includes prescription drug coverage for $0 a month. Well, how can that be? How can these plans be $0 a month? Medicare Advantage plans are funded by the government, and when a Medicare Advantage plan contracts with Medicare, it's given a set amount of money in order to cover the expected costs for its average members. So if the insurance company can save money on expected costs, for example, requiring you to use a set network of providers, then oftentimes, they pass that savings on to you in the form of a $0 monthly premium. And it's important to know that Medicare Advantage plans are not really free, right? So even if it says $0 a month, you still have to continue to pay your Medicare Part B premium generally. And you also will pay in the form of co-pays, co-insurance, and deductibles for your medical services when you use the plan. Another pro of Medicare Advantage plans are the additional benefits that you can find in a Medicare Advantage plan that may not be covered by original Medicare. Things like dental and vision benefits that are not typically covered by traditional Medicare are oftentimes rolled into a Medicare Advantage plan. Some Medicare Advantage plans also include meal delivery services if you're discharged from the hospital, and transportation services as well. Again, they're not covered by all Medicare Advantage plans, but some Advantage plans do include some of these additional benefits. Finally, with a Medicare Advantage plan, you get an all-in-one Medicare plan. Now, for many people, this isn't a pro necessarily, but I've talked to many seniors who just really like having one card that they use at the doctor, at the pharmacy, at the dentist. So you really are getting all of those benefits rolled into one plan and just one card that you're using. Now that we've reviewed some of the pros of Medicare Advantage plans, let's talk about a few of the cons of Medicare Advantage. Medicare Advantage plans are calendar year contract plans. So when you enroll in a Medicare Advantage plan, you're usually enrolling in a plan that you have to stay with for that full calendar year. And as we touched upon before, Medicare Advantage plans do replace your original Medicare benefits. Now with original Medicare, you have the freedom to choose your own providers and you have coverage nationwide. But with a Medicare Advantage plan, you're using a set network of providers that have contracted with that plan. So you are a little bit more constrained there to a provider network. It also is possible for doctors and hospitals to come in and out of network with that plan throughout the year. Another con of Medicare Advantage plans would be unforeseen medical bills. Now, while many Medicare Advantage plans have low monthly premiums, you kind of pay as you go in the form of co-pays and co-insurance for your medical services, and you're going to pay those out-of-pocket costs until you've reached that plan's finish line or that plan's maximum out-of-pocket. And in 2020, the standard maximum out-of-pocket for Medicare Advantage plans is $6,700 per year. And that's for in-network services. It could be higher for out-of-network services. And this is a con for some people because if you have an unexpected hospital stay, for example, or you have to start seeing a specialist frequently, you could be faced with thousands of dollars of medical bills that you may not be prepared for. Another potential con with Medicare Advantage plans is the need for prior authorizations. Now, traditional Medicare or original Medicare doesn't really require prior authorizations for most services. If your doctor deems it medically necessary, it's generally covered by original Medicare. But with Medicare Advantage plans, prior authorizations are much more common. Studies have shown that 4 out of 5 Medicare Advantage enrollees are on a plan that requires prior authorization for at least one service. Most of the time we see these prior authorizations for more costly medical services, things like inpatient hospital stay, durable medical equipment, or Part B drugs. Those will be some of the types of things that might require prior authorization with a Medicare Advantage plan. And this is something that can be especially frustrating for our clients based on what we've heard, because it is possible that you and your doctor could have a set treatment plan or a test you'd like to have done or a procedure, and it's possible that your Medicare Advantage carrier may not approve that. Optimally, prior authorizations are there to help cut medical spending, but they are a con to consider if you're looking at Medicare Advantage plans. Now that we've talked about some of the pros and some of the cons of Medicare Advantage plans, I want to debunk a few really common Medicare Advantage myths. Myth number 1 is that people think their Medicare Advantage plan will pay their Medicare Part B premium for them. And this is generally not the case. There are certain Medicare Advantage plans in certain areas of the country that do provide something called a Medicare Part B premium reduction, but the vast majority of Medicare Advantage plans do require you to continue to pay your Medicare Part B premium. Myth number 2. Medicare Advantage plans offer better prescription drug coverage than original Medicare with a standalone Medicare Part D drug plan. In general, Medicare Part D coverage, whether you get it through a Medicare Advantage plan or whether you get it through a standalone Medicare Part D drug plan, is really similar. They all have an initial coverage period, they have coverage gap, they have catastrophic coverage, so they really meet the same criteria there, and you don't necessarily find superior coverage for drugs on a Medicare Advantage plan versus on a standalone Medicare Part D drug plan. The third myth I want to talk about is the idea that you can switch back and forth from Medicare Advantage plan to Medicare Supplement plan every year during the fall annual enrollment period. and this is also not necessarily true. Medicare Advantage plans are not medically underwritten. They're available to any Medicare beneficiary. And every year between October 15th and December 7th, Medicare beneficiaries can join a new Medicare Advantage plan, or they can switch from one Medicare Advantage plan to another. Medicare supplement plans, on the other hand, the lettered plans like Plan G, Plan N, the plans that work along with original Medicare, those plans typically are medically underwritten. With Medicare supplement insurance, once you're past just turning 65 or just getting onto Medicare Part B, you typically do have to be healthy enough to qualify for a Medicare supplement plan. So when it comes to switching back and forth, it's important to know that if you're on a Medicare supplement plan, then generally, yes, you can switch over to a Medicare Advantage plan. You have an opportunity every fall during that annual election period that starts on October 15th and runs through December 7th. But if you're on a Medicare Advantage plan and then down the road you want to switch over to original Medicare and add a Medicare supplement plan, you will have to go through medical underwriting usually, and it will depend on your health whether or not you can qualify. Overall, Medicare Advantage plans are a really good fit for some, not so great of a fit for others, and it really depends on your specific needs and the plans available in your specific area as to whether or not this type of coverage is going to be a good fit for you when you're on Medicare. If you'd like to know more about the Medicare plans that are available in your area, or you are interested in some free no obligation quotes, please feel free to reach out to us. You can give us a call at the number on the bottom of the screen. Thank you so much for watching, and we'll see you soon.